Thank you, Danae, and thank you to the United States Breastfeeding Committee for inviting me to do a presentation on our work and efforts at the Healthy Start Center for Urban Breastfeeding in Pittsburgh, Pennsylvania. Today, I'm going to identify the problems that are related to successfully supporting the Black breastfeeding diet. I will also go over steps to build a lactation ecosystem, assess community attitudes and behaviors, and advance Black lactation professionals. The Healthy Start Center for Urban Breastfeeding has taken the initiative to eliminate the challenges experienced by our target population. By establishing the Center for Urban Breastfeeding, Healthy Start makes breastfeeding information, education, and support directly accessible to women in the community who are most impacted by poor birth outcomes. With our support, this approach can be replicated. Healthy Start Center for Urban Breastfeeding provides free access to certified lactation counselors and international board certified lactation consultants to teach breastfeeding to mothers and mothers-to-be about. We also overcome challenges with individual and group-based education, counseling, and coaching sessions. Through our LATCH program, which stands for the Lactation Assessment, Counseling, and Home Visiting Support Program, Black women in Allegheny County can receive 24/7 on-demand, in-home, and virtual breastfeeding support during their immediate postpartum period. Again, all of these services are offered at no cost. Healthy Start Center for Urban Breastfeeding employs staffs about 4 contracted certified lactation consultants, and we already have a staff that employs, our staff has 29% certified and trained lactation professionals. Some of the initiatives we started to complete this program, again, would be the Latch Support Program, which provides that immediate support for the breastfeeding family. We call it the Latch Line. So we have a phone number dedicated to receiving that support. We also created a breastfeeding bootcamp series that combines a multitude of classes over time for parents to learn more, about what breastfeeding is as a lifestyle choice. All of our classes are culturally relevant to the population that we serve because we understand those unique challenges that can sometimes hinder the success of breastfeeding. Through our high-touch communication methods, we were able to obtain data around breastfeeding practice and duration from our participants. Being as though our program is sort of low touch in nature, since our families are utilizing our services as needed, the best way that we found to connect with them to get that ongoing information about their continuation with breastfeeding, whether or not they're meeting certain milestones such as attending their 6-week checkup visit, returning to work, and the success or failures that may come about that. We instituted a postpartum survey where we send out these beautifully crafted postpartum surveys to our participants at specific intervals of 2 weeks, 6 weeks, 12 weeks, 6 months, and 1 year to obtain data. In addition, we understand the power of utilizing the community's voice and elevating their needs and desires by establishing our Community Infant Feeding Initiative. Our Community Infant Feeding Initiative is a series of focus groups that's designed to obtain information from the community around infant feeding practices to not only formulate better programming to meet our community needs, but also disseminate that information to area community providers and community organizations. In our first inaugural year, we hosted a 2-day regional breastfeeding symposium. The theme of our symposium was Breastfed, Cultural Humility, Clinical Interventions, and Community-Based Supports. We were able to use keynote speakers, Cammie J. Goldhammer, Kimberly Seals Allers and Dr. Kendall Tackett to convey the message that we intended to share with our audience. In addition, we understand that a lot of the symposiums that are orchestrated or attended are not heavily attended by community members. So we were able to scholarship 20 of our community members to attend our 2-day regional symposium. In our first year, we were able to connect with over 250 enrolled participants. We successfully completed 68 in-home consultations and 58 virtual and telephone support assessments. Our overall attendance for our breastfeeding classes was about 50%. So for us, this was a very successful year, being as though a lot of the people within the year one as well were pregnant and may not have delivered within our 1 year cycle. So I want to identify a problem related to the Black woman's unique challenges when meeting breastfeeding goals. What we sometimes look at as general information for all does not really support the needs of Black women due to their unique challenges that they experience. So just to break this down, whenever we are creating programming that supports the general population, we are missing a critical avenue of reaching the Black population. And I'll talk a little bit more to some of these reasons as to why these challenges exist, but what are some things that you can think of now that impact the success of breastfeeding for Black mothers? Some of these unique challenges are related to the lack of familial and social supports. When families are not breastfeeding informed or may not have practiced breastfeeding within their own history of supporting their own child and feeding their own babies, there isn't a lot of family that may be able to support and provide information on the benefits of breastfeeding. Without access to information and education, education sometimes being costly for moms, we're missing, and also information provided in the prenatal period. We sometimes miss conveying the information of what health benefits breastfeeding provides. With an absence of cultural humility amongst health professionals, sometimes women experience hardships in trying to access support or express their concerns related to breastfeeding. So if someone is experiencing pain, but there's a provider that believes that mother has a high pain tolerance, how much support would that person be able to effectively give to that participant? In major cities and most cities throughout the nation, there's a lot of unsupportive employment due to inflexibility. And oftentimes, as we see in our local region, a lot of our moms in this target population are employed in service industry related positions. And so due to their employment within these non-managerial positions, their break times are not as flexible as someone who has an office with a lock on it. Whenever we are also thinking about the social normativity of breastfeeding, social media has been doing a great job in promoting breastfeeding as a normal act. However, the people in the environment around a mom can greatly influence their ability to commit to breastfeeding over long periods of time. What we know about the historical context and ramifications of Black experiences throughout the transatlantic slaves period have greatly influenced the way families view connecting with their young child. When you are a slave that has to return to work and may not be able to devote that much time to nursing your baby or having that that looming note of maybe being transferred or sold into another plantation, those things that went on for 400 years have greatly impacted the way women view breastfeeding and its convenience. Not to mention wet nursing. When wet nursing came about, a lot of families would leave their children at home and provide to them infant formula so that they can obtain money through working in someone else's house. So, the priority wasn't put on their own child. It was put on, providing finances and financial stability for their own families. Lastly, we think about the hypersexualized bodies of Black women. It is most appropriate, as we see on television and through the internet, to show women in the nude, women with scant clothing, but oftentimes a woman breastfeeding her child makes a lot of people uncomfortable. And when we think about this, it truly is a disappointment, especially with knowing the anatomy and physiology of breastfeeding is directly related, to the breast, is directly related to breastfeeding their infants. Identifying another problem. So disparities exist. They are very real. And what we often see with the breastfeeding initiation disparities is the white-Black gap. So whereas white women are starting off substantially higher with breastfeeding versus Black counterparts. And so when you think about the things that you want to do within your own region, it's very helpful to understand the data that surrounds your county or your region. And so you want to think about analyzing what that local data looks like by race, because oftentimes when we look at our races, as we see in this graph here, it appears as though the breastfeeding rate is very successful for Pennsylvania, for Allegheny County. But when we look closer into that breakdown by race, we see that Black women are starting off at the least amount of percentage compared to any other race and ethnicity recorded on this data. So what data can you find that is being collected locally around breastfeeding initiation and duration? And then think about whether or not this data is publicly shared. Oftentimes, in our experiences here in our region, there's not a public availability to the duration rates of breastfeeding. You may have to solicit health network systems and pediatric offices to kind of see what data they have around breastfeeding initiation and duration. Typically, state departments of health may have information related to the racial breakdown and county breakdown of breastfeeding initiation rates, but you may have to try to do a little bit more digging to find duration rates. And this is definitely a problem that can be provided or resolved through efforts that you take up as a lactation professional or other health professional, seeing as if that's a need within your region or county. But another way that you can also understand data in a qualitative aspect is to assess the community and find out what their attitudes and behaviors are. So as I mentioned, we created the Community Infant Feeding Initiative, and the reason why we decided to call it the Community Infant Feeding Initiative is because whenever you put a breastfeeding name to things, you're less likely to receive a diverse response from the community. So we wanted to not only understand infant feeding practices related to breastfeeding, but also infant feeding practice as it relates to infant feeding, formula feeding. And why is that? Because, just as we even consider the rates in which families introduce solid foods. You know, that is something that is not subject only to the breastfeeding diet. It can be a issue amongst any infant and what they're receiving, how they're receiving, when they're receiving food, sorry. So ways that you can get to know just get to know what your community feels and what they believe around these things, because not only when you assess what their strengths and weaknesses are and what they know and what they do not know, it also gives you an idea of ways that you can provide education back into your community. So if you see that your community doesn't have enough available resources to support breastfeeding families, that is a void that can potentially be filled. So you, as I mentioned, you can increase the understanding within the community about its strengths and weaknesses, why they exist, and the importance of addressing them. When we elevate the community's voice, we let the community tell its story. We let them think of, the hurdles and challenges that they have with attempting or even committing to breastfeeding. And so what you can ask yourself whenever you're assessing your community is, what can be done better? So after you look at the data that you received and you transcribe it and you analyze it, some of the things that you can ask yourself is, what can be done better? And you can ask yourself now, what can be done better in your community? In addition, when you assess and survey your community, you increase the community engagement. So they pretty much can lead the discussion. They are more willing to jump into the discussion because they feel like they're being heard. And that's the biggest takeaway from this all. You want to make sure that your community is able to speak for themselves. You're also able to complete an inventory of the resources that are currently available and understand what gaps exist. So as I mentioned, when you're able to analyze what's going on in the community, what the community feels, and then you also take inventory of what you notice about the community, you can kind of use that information to leverage, improving that quality of life for community members by creating programming that's specific to the community needs and desires, and also disseminating that research back out to health providers. We also want to provide community organizations with research-informed evidence to assess their service delivery priorities. So there's a lot of community agencies in public health that are centered in public health that create a lot of programming that is supportive of prenatal and postpartum families. So this information that you gather, when you can relay that information to them, they can construct programs, or if you yourself are in a community organization, again, this is some way that you can also create programming that is supportive of what the community needs, but you're also able to kind of inform the way the other community organizations around you are also changing their service delivery to accommodate the needs of the community. When data is used to brief strategic planning, breastfeeding is prioritized. Quality programs have, highly successful outcomes, and you also build equitable breastfeeding practices. What we were able to do is also initiate a lot of partnerships within communities, community organizations, and providers. So ways that you can assess community attitudes and behaviors, and this is a general list, but I believe there are very unique ways that you can also engage with your community. So hosting focus groups are always great. With focus groups, you typically control the information and, well, the information that is shared, and you have smaller populations of people to allow time and room for everyone to be able to express themselves. The material is very useful because the material is transcribed and recorded. Oftentimes, you're able to use that information and quote potential, well, these focus group attendees within grant proposals, within social media, and other avenues. Hosting a town hall discussion is sort of like a focus group, but it allows you to have a larger reach. And generally, you can kind of start off the conversation and maybe have talking points that support the flow of the conversation, but typically these sometimes become group-led discussions that bounce off of various ideas between the people who are attending. Town hall discussions also give you an opportunity to be very educational about who you are, what you intend to do, and about breastfeeding information and awareness. With focus groups, sometimes you don't want to, because it's a more controlled environment, spending so much time educating families can take away from the time that's spent obtaining data. And as always, there's always surveys. They can be very qualitative and quantitative in nature. So you can assess the demographics of breastfeeding between Black and or teen moms by understanding, their regular demographics, how long they breastfeed, things of that nature. But then you can also create qualitative surveys that kind of ask participants to share a little bit of their own personal journey or provide some sort of testimony. Surveys are inexpensive. There's a lot of free platforms available where you would be able to set up surveys and distribute them to an email listing. And they can be easy to circulate. You can create bit.ly shortened URL codes. You can constantly put them on social media and reshare them. So they're very easy to circulate. Sometimes what I notice is to increase participation with surveys, you sometimes have to incentivize them. So hosting monthly raffles or something of that nature will support people taking the initiative to complete the survey. It's best to keep surveys as short as possible, but if they tend to be lengthy, you just want to make sure you are informing your potential survey completers to know that. And like I said, I know there are various ways that you can consider reaching your community, but what are some things that you think, in addition to these three pillars, that you would be able to host a community assessment? One of the other issues that we find within the medical profession and, just for the sake of this presentation, the lactation health professional field, is the lack of diversity amongst the providers. We know that there are extreme barriers that can impact a person's ability to receive certain certifications or schooling that is based around maternal child health or human lactation. And what we know is, there are a great number of peer supporters who provide support, but just in how we create that pipeline from, having them formally trained with, by a training and exam, and then going on to work and not volunteer their time and services to supporting Black families, is where we see a huge void. In your county, and just thinking about what is necessary for breastfeeding families, it is noted that per every 1,000 births, there should be, for every 10,000 births, I'm sorry, there should be one lactation professional. So for every 1,000 births, one lactation professional or one IBCLC or CLC within the region. Oftentimes, if you look into data, you'll find that these numbers do not meet or nearly or even exceed what is recommended for lactation support. But then when we break these things down by race, we see even larger gaps. So just for instance, in Allegheny County, where there is a vast number of international board certified lactation counselors, there are currently only 3 Black IBCLCs within the county. When you look at our total number of births, we are averaging over 6,000 births for Black families within our county region. So we are completely understaffed, to say the least, in supporting the Black breastfeeding diet with providers who also identify as Black. If you are, a lactation provider and you're working with either a community agency or a health network system, it is great to think about ways that you can strengthen the lactation professional base within your agency, and also look to see how that can be diversified. So I ask you, how many lactation professionals of color do you all have for every 1,000 births? So when we think about advancing the Black lactation professional, again, we know that a lot of moms or a lot of women are supporting other women through peer support networks. But having also the higher level breastfeeding or lactation support professional, with a diverse background is also very supportive. When moms receive care from someone who looks like them, it's a visual representation of themselves. There is a huge mistrust in the medical field from Black families. Having someone that looks like you can oftentimes ease your issues of fear or mistrust around receiving care. What we also know is that more likely when participants or clients or patients or families are provided care by Black lactation professionals, and I'm speaking in terms of Black families, they oftentimes spend a lot more time with the Black medical professional and are more open about their challenges and the things that they need. The other thing that happens whenever we diversify the Black lactation profession is the decrease of implicit biases related to vernacular, understanding, and experience. So sometimes there can be issues with understanding, with communication between provider and patient. And oftentimes when there is someone who can directly relate or understand what you're saying, you're more likely to be heard or feel as though you've been heard and listened to. In addition, Black lactation professionals provide culturally responsive care to the families that they service. As we said previously, there are very unique challenges that are present when supporting the Black breastfeeding diet. And some of these things, whenever programming is created for the general population, does not support the cultural aspects of what Black families are experiencing. Returning to work oftentimes before 6 weeks due to financial constraints that they may have, or just not having any network of people or knowing anyone that looks like them. When you have a Black lactation professional or a Black lactation professional network, there's oftentimes resources that are created to support these needs of a Black mother. For instance, creating a Black breastfeeding circle. When we think about what we do within this context is we it takes more than just having Black professionals within this field, but also how we as providers and how we as institutions and agencies also allow Black lactation professionals to practice. Sorry. And what I mean by that is oftentimes there are scholarships awarded to Black women to complete a certified lactation counselor training course, or scholarships to support international board certified lactation consultant exams. But there oftentimes are not jobs within the markets for these women to then go on and be compensated for the work that they're doing. So not only do you want to advance, have a visual representation of Black women within lactation professionals, you also have to think about that pipeline and how you create workforce for these women. So not making an IBCLC without an RN licensure, not making it so that they have to be an RN to work within a hospital system, or as a community agency, employing certified lactation counselors and not requiring hire the IBCLC in order to do the work, because these people are adequately trained. They're usually passionate about normalizing breastfeeding and supporting other Black moms, and so we just want to make sure that we are supporting them along their way and providing opportunities for them. Lastly, I want to talk about building a lactation ecosystem. There are a multitude of organizations, institutions, sectors that all support the mother and baby. We know we have the social aspects of the mom's peer and familial and social network. We also have childcare providers and employers and clinicians. There are hospital systems, WIC offices. It spans, from the social aspects all the way out into what we look at through government. And so it is important to understand how all of these systems work together, but also build those partnerships within these sectors, because if a mom is only getting adequate support from a community organization, but she is facing challenges when attending community clinics for the pediatric visits, or if the child care center is not allowing the mom to bring pumped milk bags into the agency, there are challenges that these women are experiencing that may not be directly related to the work that you do as a community organization or a hospital system or a clinic system, but within their peer-based supports or childcare agencies. So, as I mentioned, each of these sectors are contributing to the success or failure of the Black breastfeeding diet. So, whenever you are establishing partnerships, there are opportunities for educating, the childcare agencies or maybe hospital systems, or collaborating on building curriculum, or, extending the peer-based support network, or having a social media platform that can be utilized and providing information to these families. But these collaborative efforts, really drive in that continuity of care. The quality of care that moms receive are elevated because everyone is on one cohesive agenda. Not only that, when we think about delivery and availability of lactation support, that also amplifies, because whenever you are establishing these partnerships with these various sectors, you're also letting them know who you are as a resource to the families that they are serving. There can be various transactions rather, between each system. So as I mentioned, if you as a community organization or reaching out to a local hospital system, you know, what are some things that you all can do and collaborate and partner on to support the Black breastfeeding diet? And that would be the same with an individual provider. As an individual provider, is there ways that you can connect with community clinics to provide services or collaborate and partner on some initiative or project? And if community organizations and individual providers are reaching and speaking to childcare agencies, you know, how else can you partner? What can you provide them with some sort of training for their staff? You know, what are some ways that you all see yourselves working collaboratively? So again, when you're building a lactation ecosystem, you want to establish partnerships with various organizations and institutions within your reach. So, you know, you can find out who they are, what they do, when, where, and how. To formalize partnerships, you can um, draft memorandums of understanding. And this is especially with, you know, like organizations working directly with institutions on, say, creating that breastfeeding module that they use on their site. You know, memorandums of understanding can really formalize what these partnerships and collaborations look like. In addition, when building a lactation ecosystem, you know, there is a rapid and responsive referral process that can be implemented. So what are some ways that you can do maybe virtual or direct handoffs? You know, how does the community or the hospital uh, reach you for what you do or your service, or then how do you refer back to them for what they do? So you're able to kind of talk about ways that you all can um, refer within each network, whether you're an individual provider or maybe there's someone who was scoping out childcare agencies. And for instance, in that childcare agency, they asked a question about breastfeeding and said they were interested, but they needed to know more information. That childcare agency can then provide information to that potential client about the work that you are doing. So, you know, really think about ways that you can build a rapid and responsive referral process within this ecosystem. And then what ways do you report back to your partners to keep them informed? So you want to make sure you are also, you know, creating and developing what that follow through looks like. Um, and it can vary because it can be very dependent on which partnerships are, you know, coming together. But when you need to establish some sort of follow through to keep maybe a pediatrician updated or a community agency, you know, you're able to formalize these things within that conversation. I want to also think about how we can take this a little bit further and build collective strategies for improvement. You know, when you are assessing your community and or your state or your region, and you're finding out what trends exist, what attitudes exist, what behaviors exist, you know, is there a potential to create some coalitions amongst, you know, that group, whether it's a coalition to directly support the underserved and under-resourced populations, or it's a coalition directly supporting the Black breastfeeding diet. You know, there are ways you can take any collective strategy further to improve on the work that you're doing. You know, establishing agendas um, where you're able to, you know, normalize breastfeeding or attempt in many ways to increase the breastfeeding initiation rates. Or maybe this is something related to data and dissemination, you know, not having access to concrete data around the Black mom and their breastfeeding durations is also a way that you can, build a collective and create an agenda to work on improving that and building systems that support sharing of knowledge. So essentially, when we're building a lactation ecosystem, we're bridging the gap between community and institution, community and individual provider, community and community. And so you want to always find ways that everyone is working cohesively to support the breastfeeding family, because what we often see are breastfeeding families, breastfeeding support networks are siloed within their respective regions. So I want to thank you for participating or listening to this presentation, and I hope it was informative and helpful in your quest to supporting Black breastfeeding diets.